Being healthy doesn't mean you have to be on a diet. Diets don't work. They're set up to fail. 99% of diets fail.
One supplement for great hair and skin that women should never skip.
I would say is something that's missed out on for hair.
A certain time period in the night where you get your proper sleep, or is it just 8 hours of sleep whenever taken?
No. So if you're switching off your gadgets at about 10 o'clock or 11 o'clock in the night, you will start going into deep sleep in the early hours of the morning. And that's probably your time to wake up. So you're not getting in good quality deep sleep.
The number to it, as in the number of times a woman should be working out?
We know that even 10 minutes of exercise can help with things like cognition and stamina and strength and all of this. So at least start somewhere. Yeah, 10 minutes does a
10 minutes a day. The influence of parents, relatives coming and meeting them and telling them, hey, आपकी बेटी तो मोटी हो गई है, आपकी बेटी तो ये हो गई है. How does that play along in the mind of that 10-year-old or a 12-year-old? Welcome to the Chill Hour podcast, Health and Wellness edition powered by Swisse Wellness. Honestly, after having done over 100 episodes and a few focused on health and wellness, we realized the importance of discussing health and wellness in a little bit of a detail. And thanks to Swisse Wellness, we've been able to do this specifically focused on women's health. I've had their supplements myself and I've felt really nice and my body has felt a lot more energetic. So thanks to Swisse Wellness for being able to do that for us. In today's episode, we have Dr. Aarti Javeri Mehta, who is an internal medicine specialist and a board-certified lifestyle medicine physician. And in today's episode, we've spoken about women's health in their 30s. And honestly, if you are a woman in your 30s, this episode you can't miss out on, because we've spoken about nutrition, diets, hormonal changes, bodily imbalances, hormonal imbalances, diet, working out, if you are a new mother, how to recoup your nutritional deficiencies, the importance of supplements that come along the way in your nutritional journey and your fitness journey, how diets might not be a good solution for you if you're starting out in your fitness journey, how moderation is important and not going into extremes is not a right sort of a method to go in your fitness journey, and a lot more topics. I think if you are a woman in your 30s, this episode will talk about your wellness and health in detail. So the episode with Dr. Aarti Javeri Mehta on women's wellness in their 30s begins in 3, 2, 1. Dr. Aarti, welcome to the Chill Hour podcast. How are you feeling?
Very well, thank you. How are you? Thank you for having me here today.
Very good. Of course. I've seen a lot of your work and we thought since this episode is essentially focused on women's wellness in 30s, I don't think there could be anybody else who could have done a better job than you. So firstly, thank you so much for taking out time from your schedule and doing this. This means a lot to us.
Thank you so much. And I'm so glad you're talking about topics like this. I think it's high time, and it's amazing to see that, there's so much more awareness and education built around topics like this as well.
Awesome. So Dr. Aarti, just to sort of begin with, what do you think from your experience, from your understanding, why are 30s considered as the crucial sort of a decade for women in terms of wellness?
If you are a woman in your 30s, you probably agree with me that your 30s, something starts shifting in your body. Now, you probably feel it on the outside, but we know from science that it's a fact. That's exactly what happens. So there's kind of twofold of changes that happen in your body. The first is reproductive biology starts to change, and I'll talk about what I mean by that in a minute. And the second is kind of metabolic shifts in your body. So when we're talking about reproductive biology, we know that your ovarian count, your egg reserve, all of these kind of things start to change a little bit within your 30s, okay? And second, coupled with that, we know that there's a slight shift in things like your metabolism, your muscle, your bone health, all of this. And then compound all of that with like the normal life events of a 30-year-old, which is I'm probably trying to get my career on track. I've got a lot more kind of external environmental pressures that are happening right now. Having kids may be on the cards. So this is kind of a decade where I think it's crucial to really start investing in your health and start thinking about your health from a kind of bird eye angle view where you start looking at the bigger picture.
Got it. Um, what, according to you, are some of the things that women miss out on in their 30s, especially in terms of their health?
So the big things I think people don't think about, and I really want to start changing this, is I think there's so much of a fixation on appearance in your 30s, right? Women are just kind of stepping on this weighing scale, or they're just stepping on like, okay, how do I look, and what does my body look like in the mirror? But they miss the fact that your 30s is actually the time where you need to prepare for your 40s. So we miss out on things like, what is your body composition? How are you actually doing in terms of your muscle strength, your visceral fat, your bone health? What about your hormones? What about the metabolic changes that happen in your body? I think that's what we're missing out on, and we're kind of missing that deeper picture that's there in your 30s.
Awesome. You mentioned a little about the biological changes that keep on happening from 20s to 30s and then eventually to 40s and 50s. Can you talk us to the shift, especially from 20s to, say, particularly in 30s? What are the biological changes that a woman goes through in terms of their hormonal shifts and a bunch of other things that a woman goes through?
Yeah, so I think to kind of go back at that, your 20s is kind of the that age where your body kind of gets very set in a routine of the menstrual cycle, right? So for most individuals, or for some individuals, they'll have a normal menstrual cycle, and this is obviously barring conditions that are, endocrinological or reproductive conditions like fibroids or endometriosis or PCOS. But your body kind of gets set in that. From the 30s, your hormones start to fluctuate a little bit. So that's when your estrogen levels, progesterone levels may start to fluctuate a little bit. These are essentially the female hormones. And with those changes, you can start seeing changes in your menstrual cycle. So if you were someone who had a very regular menstrual cycle, you may suddenly start noticing, okay, my periods have become a little bit heavier, or now they're a little bit scantier. It's changing in terms of how long it takes to get a cycle every month. There's slight variations show that there is some levels of fluctuation. I think the other big thing that's commonly missed out on is energy changes and energy levels as well, right? We start to take for granted those energy levels that you had in your 20s. And personally as well, I know that for me, that big shift was 35. I think after the age of 35, there's some transformation that happens in your body, and you become a lot more sensitive to the hormonal shifts in your cycle. And this is not just a feeling, but we know that certain women are more prone to the hormonal shifts that are happening within their cycle. And we can tell that from the genes, the way they interact with their environment. So as a woman, we commonly kind of think, oh, you know what, the hormonal shifts that I feel in my 30s or my 40s is just a part of the aging process. But it's not that. It's your genes are affecting the hormones are affecting your genes, but all of this is related to your environment and your lifestyle as well.
Okay. So you mentioned a little about lifestyle. So can you touch a little more upon that in terms of how your lifestyle, how your environment sort of changes your hormones and your genes, and how a woman essentially is feeling in her 30s?
So I think the first is to understand what lifestyle is. Okay, so lifestyle medicine, which is basically what I'm board certified in, this is an evidence-based practice of medicine where you go through basic pillars. The first is nutrition. The second is movement. The third is sleep. The fourth is stress management. The fifth is connection. And the sixth is substance abuse. Okay. Now, we know that when you're thinking about these 6 topics, they interact with your genes. Okay. So you may, for example, within your 30s, you may have certain genes for certain conditions that run within the family. So take a woman with PCOS, for example. They may have specific genes that predispose them to having the condition. But we know that with lifestyle changes, we have the ability to switch on or off those genes. So that's how powerful lifestyle is within the management of certain conditions, or even within your genes or your metabolic shifts, because we know that the more you alter your lifestyle and all these 6 pillars, the more you can actually influence how your genes are and how they are expressed. So it's a magnificent shift. It's something called epigenetic changes. And that's actually the power of lifestyle and how you can actually switch on and off genes and actually change your fate or change your outcome. I think in India, in South Asia, in all of our cultures, like we have this very big thing of, my mom had it, so I'm going to get it. Or we have diabetes that runs in the family, so I'm going to get it. But we know now that when you're changing your lifestyle, you can actually switch off those genes completely. So I think the big thing for women in their 30s to understand that it's not too late. it's never a point in time where you feel like just because my mom had it or just because someone went through this, I need to go through the same thing. There are these small changes that you can make on a daily basis that kind of help you to change your outcomes.
Dr. Aarti, how important are female friendships when it comes to actual discussing health and wellness among women and in general female friends?
So important. I think we forget about this, right? I think we're so obsessed with like, what should I eat and how should I exercise and like all of this, and we forget about the power of social connection. And that is one of the pillars of lifestyle medicine, right? We know from our studies, like the Harvard study of adult development, we know these kind of studies are there out there that shows that when you have social connections and you have meaningful relationships and you have a support network, you thrive. We need to get out of our head that, even for example, like what we do a lot with Sustain Health in our company is we have women who have, for example, different medical conditions, or they may even be women who are well, but just bringing them together on this common aspect of, you know what, we both have PCOS, we've not talked about it to anyone else, where we have that safe space where we can connect on that, or we can build these meaningful relationships around that. That has been shown to improve outcomes. We know that when you have meaningful relationships and connections, you are actually going to have better health outcomes as well. So I think it's really important that in our society, we start getting rid of these stigmas and these boundaries of we shouldn't be talking about this condition and we shouldn't be talking about this hormonal condition, or don't talk about this, it's not good. I think the more we bring it out there and the more we actually talk about it, the more we can start thriving with the condition rather than feel like I'm just dealing with it.
And I think female friendships in general are a lot more open,
Yeah,
where they
100%.
discuss a lot more things, and they sort of sit with each other and cry with each other, and dance with each other. And I think that sort of is very beautiful because you can create a space for expression and vulnerability. I think that becomes really important, especially in the overall health of
For sure.
a woman.
Yeah, and also the non-judgment. I think the non-judgment is so important, right? And having that safe space where you can pick up the phone and you can call someone and just kind of speak to them about what's on your mind.
Why are female friendships so beautiful? Because I see a lot of my female friends sort of say that, hey, we're going on a girls' night and this is going to be like a a girls only dinner or a girls only brunch, and
Yeah.
we're just having fun. What makes them very special in terms of
It's
other
it's a
friendships?
form of kind of, we know that it builds the attachment. We know that your hormones that are involved in nurture and that are involved in happiness, whether that's dopamine, serotonin, all of these get activated when you're around these meaningful connections and relations.
Awesome. Which brings me to my next question, which is, do you think women in their 30s, especially in their 30s, need to start monitoring their hormone health regularly, even if they feel fine, even if they feel ki haan, theek hai, everything is okay,
Yeah.
but I still want to sort of monitor it regularly?
So I think the big thing is to monitor but not obsess. Um,
Okay.
because I see both ends of the spectrum, right? Where a woman doesn't come and they come to me in their 40s and they're like, I just went through my 30s without anything, and now I'm like dealing with all the stuff that they see in their 40s. And then you have the other end of the spectrum where you have a 30-year-old coming to me every month and is like, test my blood, and that's not required as well. So I think you need to find a very nice, even middle ground. If you think you're healthy, is number one, do the bloods. So you need an annual blood test to be done. This can be to check for your hormones or even not to check for your hormones. There may be slight variations in your period cycle. I think it's important to just start tracking these within your 30s. And you will start realizing that there may be slight shifts, right? Things that you've kind of normalized over a period of time, but the more you go with this kind of objective data to your doctor, the more they will start being able to prime you and help you understand that, you know what, in your 30s, this was like this. Let's test for the hormones now. This is the right time to test for it. Not even hormones, but even nutrients, minerals, vitamins, all of these things are really important to test for as well. This is something that's very commonly missed out on, and I think it's something that can really help improve outcomes. And the third thing that I would say is body composition. I think if anything at all, start testing your body composition at least annually if you can when you're in your 30s, because you will start understanding how your body changes in terms of muscle ratio, in terms of fat ratio. because that will kind of help you to tweak and alter your lifestyle plan so that you're at least maintaining that muscle mass, which is so important in the 30s. So I'd say definitely you
Got
need
it.
that monitoring, but find that nice balance.
How to not obsess? Because this is such an interesting topic where we're talking about health and wellness, and if something goes wrong, there are so many people, and I'm not a woman, but as a typical man, I also sort of have this problem of overthinking. I try and overthink every particular scenario. I would, sit with a diary and a pen, and I would just maybe make a list of pros and cons. I would just weigh out everything, and then I'm gonna be sad. I'm gonna maybe have, say, a chai or a coffee in the night. That leads to lesser sleep in the night, which leads to a lot more problems. So, how do you not obsess over something, and how do you sort of create that balance? Or maybe what are some of the checks that women should undergo? You mentioned about a couple of tests. If you can just repeat those tests that people, essentially women in their 30s, should be undergoing so that they don't obsess over it and
Yeah.
create a larger problem in their heads.
Yeah, of course. So I think number one is find a healthcare professional that gets it, right? One that is kind of has that nice balance. Blood tests, mainly basic kind of blood panels, whether it's a complete blood count, your iron status, your vitamin D status, thyroid, and hormones, right? Those are the kind of 5 big ones you want to look for on your bloods. The second is a body composition. Really check for a body composition. And the third I would add in would be mental health as well. I think it's really important, and that's going to tie into the obsession kind of the reason. I think it's there's a reason why they're obsessing, right? There's an underlying fear that's there, or there's an underlying reason why they're overthinking. The more you're able to empower your patients, and the more you're able to give them education on why certain parameters are the way they are, the more they'll be able to go home confident and being like, you know what, it's fine. They said it's fine. I need to work on this, and I'm good. But that obsession comes from fear of the unknown. And that's what we need to kind of work with.
What do you say about working mothers? There are a lot of mothers who are working mothers like yourself, and I'm sure you're also on a routine, and your calendar is absolutely packed. So how do you maintain a work-life balance where you're spending time with your family and you're working as well? Do you put time that you give to your family as well on the calendar? It's a weird question, but
I do, honestly, because if you don't schedule it, it's very unlikely to happen. And look, we're not perfect. I think as mothers
yeah.
and working moms, there's nothing called balance, right? I think some days you're at 150% and other days you'll be at 0%, and that's fine. I think this whole concept of balance is very overrated. And I'm sure if you're a mom and you're working, and, even forget about working moms, I even think stay-at-home moms or anyone who is kind of just living life as a woman, busyness and that scheduling is always there. I personally have specific times of the day that I block out. So for example, working out is something that I find a non-negotiable because it really kind of helps me, stay mentally focused. My 5 a.m. to 6 a.m. is a workout. So I will make it a point to wake up at like 4:30 to make sure that I get that workout in.
That is every single day.
Not every single day, a few times a week, but it's definitely something I block in. And then I have maybe an hour or two in the evening where I will block out a phone-free time where I'm just with my children. But if you don't make that conscious effort, I think it's going to be very difficult to kind of have in. And I think it's important to realize that the small habits really compound over a period of time. Like a lot of moms think, oh, but if I can't work out 5 times a week, then what's the point? Or if I'm only getting in that 20-minute block in the morning to work out, then what's the point? And I think that's far from true, right? Even we know from our studies, if you're getting in 10 minutes to work out in the morning, do it, take it, because that will help you. If you're getting in those 3 minutes to breathe or to reflect or to do something in the morning, take those 3 minutes, because over a period of time, they really help accumulate and build into those habits. Like we know from this concept, your habits essentially will start snowballing, and you have a snowball effect on your overall lifestyle as well.
Correct. What do you think in terms of? So, if you can tell me, what are the things that you do when you block your time with your children? Is there a specific task that you do, or an activity that you do with them, or you just sit down with them, have fun, share stories?
I wish it was that, and I wish kids these days weren't so busy, but it's usually kind of going to a class, or it's, finishing off something or reading. It may be game time. It may be just spending time with them. So it really depends day to day. But I think having that little bit of quality time where like they also know you're 100% present for them is really important. Like, I think just because you're there physically does not necessarily mean that you're there mentally. And I think as a mum, whether you're working or whether you're not working, I'm sure you can relate. But for me, I think the biggest learning curve has been I don't need to be there 24/7, but when I am there, I need to be mentally present.
Hmm. Have you ever been present and then you sort of be present with them physically, but then your mind is somewhere else
100%,
because you
or
have
so
so much
many
to take care
times,
of?
so many times. And I'm saying this, and like a lot of the time you just don't have the option. You will be on your phone, or you will have that email to answer to, or you're not mentally there. And that happens a lot, but I think that's normal. I think we need to also, as moms, provide ourselves with that compassion that it's okay and it's a normal process, and that's bound to happen on certain days, and it's fine.
But how do your children react in that case? When they see that you're there with them, but then, hey mom, you're on your phone while you're with me.
It's
That's not
exactly
right.
it's exactly what you said. That's exactly what happens. They're old enough now to understand, and you kind of respond in the sense of, yeah, I know I shouldn't be because I'm with you, but I need to really finish this. And I think it also allows them to understand that there are certain things that need to be done, right? Or there are certain priorities that have to be done even when it's playtime.
Right, right. Dr. Aarti, I want to talk to you about sleep.
Yeah.
I think that becomes, and I think that is of paramount importance, more so with people women in their 30s, because that is a changing shift. Um, a lot of women essentially are not sleeping well. So, would you say that there is a certain time period in the night where you get your proper sleep, or is it just 8 hours of sleep whenever taken
No, so there's
throughout the night?
definitely, so what we need to start understanding, there's something called the circadian rhythm, which is basically your
Right.
body's natural clock. And that is very much influenced by the outside world as well. So back in the day, and I'm not sure if you ever go on these holidays where, you're in the middle of a village and there's not that much natural light, there's not that much indoor light as well. Normally, when the sun sets, what happens in those cases, the sun will set, your eyes sense that darkness, right? And you have signals sent to your brain, and that starts making something called melatonin about 2.5 hours after darkness. Melatonin is basically the sleep hormone. So you may start falling asleep. You will start going into deep sleep at about 7 hours after darkness, and you get a good chunk of deep sleep, maybe about 3-4 hours in the night. And then sun rises again. You stop making melatonin. That's when blood pressure rises, heart rate rises, all of that to get you out of bed in the morning. Now, in the case of today's world where we have our gadgets on, we may not necessarily be, in dim lights in the evening. We've got our phones on, our laptops on. All of these have something called blue light in it. So it basically tricks your brain into thinking it is not nighttime outside, it is daytime outside. So you will not start making melatonin. You will only start making melatonin after darkness. You will go into deep sleep. So if you're switching off your gadgets at about 10 o'clock or 11 o'clock in the night, you will start going into deep sleep in the early hours of the morning. And that's probably your time to wake up. So you're not getting in good quality deep sleep. And that is a big shift. And that is what we see is really happening to women, where at midnight, when your cortisol levels are supposed to be low, or when you're in your deep sleep and you're supposed to be getting muscle reparation, cognition, memory, all of these, digestion slows down, you start regulating hormones, mood. When you're not sleeping well, all of this is thrown off whack. So sleep is probably the foundational pillar to lifestyle medicine. That is what I always say, because without adequate sleep, it becomes impossible to make changes. If you're not sleeping well, it's not just 8 hours, it's not just about the time in the bed, right? It's the quality of sleep as well. If you're someone who has been gadgets off at 6 p.m. and you're sleeping at your 10, 11, and you're getting 8 hours in the bed, your quality of sleep is going to be very different to someone who's got their gadgets off right before they're going to bed, and they've had their last cup of coffee before going to sleep, and they've had a really heavy meal, and they've not been exercising. even if they get in their 8 hours sleep, they may not necessarily get good quality sleep.
I feel you're talking about me in the latter part where you're like, minus the exercising, because I'm regular at exercising. But apart from that, I think you're just talking about describing
Yeah, so
me there. But I
quantity
just want to
doesn't
sort
equal
of,
quality.
sorry?
Quantity doesn't equal quality. So it's not just 8 hours anywhere.
Right. So you mentioned that after, say, when the darkness sets in, 3 to 4 hours from there, or 6 to 7 hours from there, you sort of try to get your sleep without your gadgets. My question to you, Dr. Aarti, would be: does it make a difference if you keep your phone on your bedside while sleeping? Does it affect your quality of sleep?
So a lot of individuals, what they tend to do is they tend to switch on their phone in the middle of the night, or they'll check their phone in the middle of the night. If we know from our studies, if you have your phone in a completely different room, you're more likely to get better quality sleep.
Is it possible in
It's
today's age?
very tough. Very honestly, it's very tough. So I always tell patients, look, it's very easy to put all of these kind of perfect scenarios out there, right? But practically, what we can do are the small things. If you're switching off your gadgets at midnight, start with 11 p.m., start with 11:30 p.m. If you're someone who is having your last cup of coffee at 6 p.m., or you're having your last chai at 5 p.m. and you feel like sleep is a bit off, make that after lunch. There are so many other things I'm sure that you can fix before shifting your phone to another room if that's something you find difficult.
Got it. Got it. Um, Dr. Aarti, you mentioned about getting up at 4 or 4:30 in the morning to get your workout in place, which seems to be a Herculean task for me because I at times get sleep at 4 o'clock in the morning, which is weird for me and my cycle and my circadian rhythm rather. But weight management, or rather a lot of people in terms of essentially women in terms of their 30s, uh, weight management and the way they look seems to be a big factor in terms of how they feel mentally as well. Um, do you think that women in their 30s, despite exercising, weight management is still a problem? And why do you think that is? Is it because of hormones? Is it because of sort of metabolism slowing down? Why do you think that is?
So it's not so much metabolism slowing down. I think it's a very big misconception that, and I have women tell me this, that my metabolism is slowed down. It's not so much that, rather than body composition changing and hormones changing. So we know that in your 30s, you will start losing a little bit of muscle mass every decade unless you're doing anything to actively build it up, right? And your muscle is the most metabolically active tissue. So the more muscle you have in your body, the more calories you burn essentially, right? But if you're losing a little bit of that every decade and you're not really working out, or you're not supporting your muscle strength or your or your lean mass kind of preservation, then you will start noticing those changes. And the second one is that insulin levels start to get a little bit dysregulated. So you may find insulin resistance is a little bit higher as well. Because when you get into those 40s and when you get into late 30s, you will start realizing that you will have a little bit of fat redistribution around the midsection. So those are two
Okay.
big kind of things that we start seeing where women are like, you know what, I'm working out, I'm eating the same way, but still I'm not 100% happy. I think we need to start understanding that one, our bodies will change over a period of time. We need to also accept that. Two, is it something that is pathological? So is it you actually have a hormonal issue? There's an issue with the way you're, metabolizing certain things. We need to address that. And the third is it minor lifestyle changes or fixes that you need within either your nutrition world or your exercise world that can help you get to the results that you want to get to? Now, if you're someone who tells me, I was 10 kilos lighter 10 years ago and I still wasn't happy with my weight, that for me is not an issue of hormones or of weight or of any of that. It is an issue that we need to start dealing with. It is a mental health issue where you're struggling with body image, which is a really very real thing, especially in today's society. Women are not happy with the way that they look. And that is irrespective of the number on the weighing scale. We see it more and more and more now. And I think it's become pronounced with this entire wave of Ozempics and Manjaros, where we've started to kind of make skinny fashionable again. And we've essentially caused a lot of harm to mental health and to body image.
Why do you think the body image is popping up way too much of late?
I think the way in which society as a whole views weight loss. You know this as well, right? Like in any Asian family, the first thing that anyone comments on is weight, right? You've become fat, you've become thin. That's like the number one topic that's spoken about when you first see someone. And somehow as a society, we've said that, oh, losing weight is a good thing. But it may not necessarily be a good thing because you don't know what's happening in a woman's head at the same time. Number one, as a society. Number two, as a medical society as well. We've essentially demonized women who are living in a larger body, which shouldn't be the case. There are some women who live in a larger body who are completely healthy, hormonally, metabolically. We need to be able to understand that. But when we're just looking at really archaic parameters like BMI, for example, you're really taking it back, and you're not really looking at a woman as a whole.
So, how much should a woman be exercising in a week if there's a certain number to it? Because, like as you mentioned about exercising as well, and that becomes of paramount importance because, irrespective of a man or a woman, exercise and fitness should be very important and should be part of routinely. You also mentioned about your workouts being non-negotiable. You're very anal about your workouts. Do you think, is there a particular number to it, as in the number of times a woman should be working out?
Our guidelines suggest 150 minutes of moderate intensity exercise a week. So basically, moderate intensity means you can talk, but you can't sing. Right?
So
it's either
that's 2.5 hours.
150.
That's not bad.
Yeah, exactly. So a lot of women think that, oh, I need to be slogging for an hour in the gym every single day. That's not the case. I think it's really important that we start working out smartly. So you need that 150 minutes of moderate intensity or 75 minutes of vigorous intensity where you can't talk. Now, I think 150 minutes per week is a little bit more doable. And I think in addition to that, we need to think about non-exercise activity thermogenesis, which is basically, I'm going to park my car a little bit further. I'm going to get up every 30 minutes when I'm in the office. I'm going to walk up the stairs. We know that actually helps to improve longevity and outcomes as well. And if you're someone who can't get in the 150 minutes of exercise, we know that even 10 minutes of exercise can help with things like cognition and stamina and strength and all of this. So at least start somewhere. Yeah, 10 minutes does a massive
10 minutes
boost.
a day?
Yeah, it's called the power of 10 minutes. So we know that it's been shown in studies to actually have massive health benefits. So if you're someone who's really starting out at zero, I'd say get to those 10 minutes first. Do those 10 minutes every day and gradually build yourself up over a period of time.
That is insane. I think 10 minutes is pretty much doable.
Yeah, of
10
course.
minutes, the cycle of 10 minutes throughout the day.
Put on that timer.
Multiple times.
Yeah, of course. Even 10 minutes 3 times a day is fantastic.
How can new mothers rebuild their nutrient reserves?
To help build nutrient reserve, if you are someone who is feeding and lactating, I think it's really important that you're getting adequate protein. You know how women do that 40-day kind of 40-day post-delivery kind of period of a very strict protocol of food. I think that really has great benefits to it because the majority of foods that you're focusing on during that time are foods that are rich in fibers, like all your sabzis, your dals, things like that. They're rich in whole grains. They have a lot of healthy fats in them, whether that's the nuts or the seeds or even forms of coconut. We use ghee a little bit. And they really help to improve protein balance as well, right? So making sure you're consuming adequate protein during this time is also really important. Things we want to focus on are things like iron, vitamin D, omega-3s. These will really help to kind of rebuild that nutrient balance within a woman. And the fourth thing I think we commonly miss out on is hydration. Especially if you are breastfeeding, hydration is extremely important. So I think kind of building on from that sense, like those first 40 days, I think it's fantastic to have like a very kind of structured way of eating.
In terms of your iron, your vitamin D, your omega-3, does supplement also help? Because I'm sure that your nutrients will not be enough in terms of providing an ideal plan, so to speak. And I'm sure supplements have come in very, very handy, especially for me. I've been consuming certain supplements and that have come really handy in terms of how I feel and how my body feels, and I've felt a lot more energetic after having those supplements, and I think that's been really wonderful for me. So what would you say
Yeah, of course. So
about this?
there's kind of postpartum vitamins which are fantastic, that are kind of they're multivitamins that really do help. But then on top of that, you may need extra ones like an iron, like a vitamin D, or a B12 to kind of help you get to normal levels, because sometimes, and very commonly, especially if you're vegetarian or if you've lost a lot of blood during the delivery, you need to kind of rebuild those stores with that extra help as well. So supplements are definitely something that needs to be kind of considered with your doctor.
Awesome. I think that probably is like a disclaimer statement where you say that this is going to be in consultation with the doctor, but then of course supplements do help. I think the word supplement is in addition to your particular diet, and I think that becomes really handy because once you have a supplement along with your natural diet, I think that becomes pretty handy in terms of your overall holistic development of your health and wellness.
Yeah, for sure. And I think the other thing about supplements is that we need to realize that it's not the more the merrier. I have patients who come to me, especially women who are like, I've heard magnesium and ashwagandha and omega and vitamin, all of these, and I have a whole bedside full of them and I don't take any of them. So I think instead of doing that, it's really important to understand what your symptoms are, where are you naturally lacking in these kind of areas of your nutrient profile or your vitamin profile, and what can you
Right.
take that's going to be very effective for it.
Awesome. Just to take a little break, I have a Swiss segment, which is powered by Swisse Wellness, and I have a rapid fire. We'll try to make it rapid. We'll try to make it full of fire, as Karan Johar says it on Coffee with Karan. So I have a couple of questions. We'll try to make it as quick as possible. Are you ready for the rapid fire?
Yeah, sure, go ahead.
Awesome. If you could give one supplement to most women in their 30s, what would it be?
Vitamin D.
One thing women in their 30s should stop stressing about:
Perfection.
yoga or HIIT?
Oh, that's a tough one. A mix. It has to be a mix.
Awesome. One habit that's a total underrated superpower for wellness.
Sleep quality and consistency.
Could you explain cortisol to us like you would to a 5-year-old?
It's a hormone
That
that's
gets you worried.
essential
All
for
right.
life, actually. So,
Okay. First wellness habit you'd asked women in their 30s to drop immediately.
chronic sleep debt.
Okay. One supplement for great hair and skin that women should never skip.
That's a big one. Iron probably is going to help with that, but also I would say this is when being a doctor doesn't help with rapid fire. Um, I would say iron is something that's missed out on for hair.
What about skin?
Skin, combination of things, honestly. Reversitrol is fantastic.
Okay, awesome. One hack working mothers need to deploy to stay healthy:
Self-care.
self care. Could you
Yeah.
go a little deeper on that? Because now we're at the end of the rapid fire. So
What
you
do
can take a
you
lot more time to answer the
I
question.
think, what do you do for yourself, right? I think very commonly when I ask women especially women who are mothers or new mothers, they've kind of lost themselves. They have no idea, what they enjoy doing for themselves that doesn't involve their child or their routine. But to get to the true essence of how do you unwind? How do you prevent that burnout? How do you prevent that chronic stress? You need to start understanding what your form of self-care is. What do you enjoy doing that doesn't involve your kids, and that doesn't involve your husband, and that doesn't involve your schedule? So I think getting back to
Yeah.
that and to the core of that is really important. So finding purpose for yourself as well.
Do you think that gets lost after you give birth to your child? Because then everything and your prime focus in your life becomes taking care of your child.
For sure, very naturally, right? It happens to all of us, and we
Yeah.
probably all
Yeah.
go through waves of that. But I think eventually getting back to that, your purpose and your self-care is paramount. And it's so cliche, but I do believe it is very cliche, but I do believe that if you're not your 100% and you're not feeling 100% yourself, you're not going to be your best version of yourself to your kids.
So you become an example of who you are, become a living example of what you're preaching, and then actually ask your kid to basically follow that. But do that yourself first. That becomes important. Uh, I want to talk to you a little about nutrition as well, because I think that is, you mentioned the 6 constituents and you also mentioned the kind of food you eat. Um, do you think that is the most important aspect when it comes to actually taking care of yourself for women in their 30s? Because I have a lot of friends, a lot of women friends who are in their 30s, and they are working women, and they're not able to get their sleep right because it becomes too hectic at times, and it's filled with travel. And because of that, the kind of nutrition that's required for the body, the kind of workout that's required for the body, the kind of sleep that's required for the body, essentially every other constituent that you've mentioned for a healthy lifestyle goes for a toss. And then that takes a toll on the mind, which eventually takes a toll on the body, and then the overall health goes for a toss. So essentially focusing on hustle culture, which is taking the conversation back to question one, how can women focus on their diet properly despite the hustle culture and in terms of the hormone fluctuations as well?
I would say the first is to structure it and be very kind of clear in the direction that you're going to take to help you get to a balanced plate. Okay.
Okay.
Being healthy doesn't mean you have to be on a diet. I think that fact really needs to go, very far. Diets don't work. They're set up to fail. 99% of diets fail. And I'm sure if you're a woman and you've been on multiple diets, you know this, right? You start off on a Monday, you feel like, oh, I'm going to do this, I'm going to feel amazing. By Friday, you're in the same place again, right? So, and we've all been there, and it just shows you that it doesn't work for your life because life hits. You need to get on that flight, like jet lag kicks in, all of that. So I'd say the first thing is to, number one, get rid of this diet culture or this mentality that you have to be perfect with what you're eating. But I think you need to have very big non-negotiables. The biggest mistake I find people make, especially in this whole thing of like, I want to maintain my health and I want to maintain my weight, is they undereat. We're undereating so much as a population, whether it
Really?
is
Like, do
undereating
you think
in
people are
terms of the
under-eating,
right
or there's a
nutrients,
lot of stress eating? I feel that's happening.
undereating in terms of the right nutrients, vitamins, and minerals,
Ah, got it.
right?
Fair, of course.
Right? There's
Of
a
course.
lot of kind of there is a lot of kind of overeating in that sense, but I think we've not gotten to the root cause of that. Why are you eating is because out of an emotion, because it's hectic, because it's a schedule. But we haven't asked in the first place that that's the reason why you're eating. So I think the first thing is make sure that you are prioritizing kind of your fibers. Make sure you have adequate protein. And protein, I can stress, is so important because if you're working out 3-4 times a week and you're not consuming enough protein, your workouts are going to be futile. You're not going to get to the muscle strength that you want to get to. You're not going to preserve muscle mass, right? Because you're under eating in that sense. And then I think what we find obviously within our culture is like the amount of refined carbs that we have is extremely high, right? We also very much have a culture of eating a few breakfasts in the morning, having a few snacks in the afternoon. We don't necessarily need that. I think we're not, as women in our 30s, we're not necessarily growing babies anymore, but we need to also be able to honor that your appetite will change at different parts of your cycle. So if you're someone who's trying to keep your food exactly the same throughout your cycle, you are setting yourself up for failure. Naturally, what happens in those last 10 days of your cycle, your protein requirements increase. Your metabolism or your appetite may increase as well. Okay? So it usually increases by about 15%. Honor that, understand that, realize that, I need to actually improve and I need to increase the amount of calories that I'm consuming. The more we're able to work with that and we can structure it throughout the months, the better you'll find that you're able to stick to something. But I think the biggest one is to start asking yourself, am I actually hungry when I'm eating, or am I eating out of a habit? And
Mostly
hunger,
it's because of
it's
habit or stress eating or binge eating, rather.
exactly. And that's what we need to start getting to, right? It's not so much about what's on your plate, it's about why you're eating in the first place. If you're eating when you're not hungry, and if you're eating out of, simple kind of other triggers, it is most likely not going to be required for your body at that point in time.
how do nutritional deficiencies react on the body? How do you know that this is because of a nutritional deficiency and not a
You
psychological
mean physical
deficiency?
symptoms?
Or a psychological, or it's not
So
psychological,
physical
rather.
symptoms, it depends kind of which nutrients we're talking about. Like for
Yeah.
example, if you're someone who has heavy periods or you're losing clots in your period, you may have iron deficiency. That can show up as kind of feeling very fatigued. You may be a bit short of breath. You may find that you're looking a bit pale. If you're low in vitamin D, it could be things like joint aches or pains. You're struggling to kind of hit your movement goals because of that joint aches and stiffness. If it's B12, it could be things like tingling sensation in your hands or feet, memory or cognition issues. So it really varies depending on which kind of vitamins, nutrients, and minerals are missing. But when you're doing kind of your overall blood panel, it kind of shows through with these things.
So in that case, what would be like a starter kit of 3 to 4 supplements that women should be taking in their 30s?
So obviously first test and then treat, especially for things like vitamin D because it's a fat-soluble vitamin. But I'd say vitamin D is fantastic. Omega-3s if it's not something you're getting into your diet, and magnesium glycinate. I think magnesium is fantastic in terms of overall improvement in rest, regulation, recovery. All of these things are fantastic with magnesium.
Got it. Um, I was recently out with a couple of my friends, and we were discussing about hypnic jerks. Essentially, men. This one friend of mine who was discussing a story where he said that as soon as he goes to bed and tries to sleep, he gets a jerk on his shoulder, and then he normally sleeps. And I was reading about it. It's called hypnic jerks, and because of those jerks, so somebody who is a little into health and wellness, he mentioned that it may be because of a deficiency in magnesium. So he basically had recommended him to of course, with due tests in mind, but he had recommended him to get a magnesium supplement. And that sort of helped him rather. He'd taken the supplement and that sort of really helped him regulate his sleeps better. So do you think magnesium is like a game changer for sleep and rest?
I think for a lot of women, it has been a game changer. So, magnesium glycinate in particular has been fantastic to kind of improve sleep quality and quantity as well, sleep quality more. So, I'd say definitely it is something that I usually find has been very, very helpful for women.
You mentioned about omega-3 as well. I want to touch a little about omega-3. What does omega-3 do to the women in terms of their hormonal changes and how they feel externally as well?
Yeah. So omega-3 kind of works as an anti-inflammation kind of supplement, right? We know that omega-3 is very commonly used for individuals that have heart issues or that have really high cholesterol levels. So if you are getting omega-3 adequately through your diet, so things like your avocados, your nuts, your olive oils, if you are someone who has fatty fish, things like this, it actually helps to improve that anti-inflammatory pathway in that process. Our female hormones are made from fats. So for women who are not consuming enough of those fats, we will have dysregulation and you will find things like irregular periods come through, especially if you're very, very low on those fats. So this kind of helps with that as well in terms of just that anti-inflammatory process.
Got it. Do you think a lot of women are going through inflammation problems or rather bloating? Do you think that's a common problem?
So kind of two separate things. When it comes to inflammation, we know that a lot of chronic diseases, whether that's things like diabetes or even polycystic ovary syndrome, so PCOS is a condition that causes this chronic low-grade inflammation. Now, is this particularly inflammation that I'm going to see on a blood test? No, but we know that your body is kind of in this inflammatory state. That's where we know that diet and things like this will help with that inflammation. What was your second question?
Bloating as well.
Yeah, so
A
bloating.
lot of women
There
feel
are
bloated.
so many different causes of bloating. So bloating has over 30 plus causes. Okay. I think it's
Okay.
really important to understand why the bloat is there. Firstly, is it this normal feeling of fullness or is it actual bloat? A lot of women come to me and they're like, my tummy sticks out a little bit after I have a liter of water or after I finished a full meal. I said, congratulations, that's really good. It's supposed to happen. That's exactly what's supposed to happen. But It's the bloating that gets pathological. So it causes, this upset stomach. It's uncomfortable. You have other associated symptoms. That's the bloating that we really need to kind of go into more depth. Some of it can be related to gut health in itself. Some of it can be medical conditions that are related to the gut. So it's really important to ascertain what kind of things are causing that bloat and then get to the root cause of that.
A lot of Indian families, per se, when there are young girls or young daughters who feel a certain way by looking at themselves in the mirror. If they're overweight or if they're a little obese, or even if they're not overweight, they feel that, oh, I've become fat, my belly is coming out, I don't look beautiful. And the second aspect to this is the influence of parents, relatives coming and meeting them and telling them, hey, आपकी बेटी तो मोटी हो गई है, आपकी बेटी तो ये हो गई है. How does that play along in the mind of that 10-year-old or a 12-year-old?
So I think it's important that we take this topic and we kind of dissect it, because what I see in my clinic is 30-year-olds, 40-year-olds, 50-year-olds, even 70-year-olds who come to me and they really struggle with nutrition, with diet, with weight. Why? Because of some seed that's been planted in their head when they were an adolescent or a teen. And that just goes to show how powerful that relationship with your child is in that house when they're growing up. This is a point in time where they're so vulnerable, right? Girls actually start developing body awareness by as early as age 6. Hormones start changing by that 6, 7. Body awareness for some start developing at 3 years old. So they start to understand how their body kind of functions in response to other people. By about 8, 9, they will start realizing, okay, my body's starting to look different from the person's next to me. And then when you kind of hit, and it's happening earlier and earlier now, but when you're kind of hitting those years of when you enter puberty, that's when you really start to realize the body changes. And very naturally, what will happen is hips will widen. You will deposit fat around that lower kind of section of the body. That's normal. I have women and moms coming to me saying, my child is going to get her period. She's just getting a period, but I've told her she has to be very careful or she's going to get fat. And that's probably the worst thing that you can do at this point in time, because number one, this poor girl is going through all of these physical changes. Her mood is changing. Her hormones are all over the place. And then on top of that, you're placing the seed of doubt in her head to tell her she's become too fat, right? And that's where it sparks all this concern for, I'm too fat, I don't look good enough. This is where body image issues start. And that also trickles down into mental health issues, whether that's anxiety or depression and so on, right? So when you're kind of stuck in that cycle, then it becomes very difficult to be able to adopt healthy habits. It becomes difficult to speak to someone who you trust or to develop relationships with those around you. And you start developing a bad relationship with food.
And how do you have a word for, and I don't know, I don't want to sound negative here, but do you have a word for Indian families to do better here?
Don't police. Don't police. I think it's so important. If you have a 13-year-old daughter who is having a body that's changing, okay, obviously we want to make sure she's healthy, get certain checks done if you think there's really medical issues, or speak to a healthcare professional about it. But try not to police what she's eating, what she's not eating, because at the end of the day, that's going to backfire in your face.
I think that makes it very interesting, because all we see, and we've seen this in and around Indian families, we've seen it in our own families and seen it in families of our friends, and that creates a negative repercussion. This happens in therapy as well. When you go to therapy, a lot of counseling psychologists and therapists would tell you that whatever you're feeling right now, it could be because of your childhood. And I'm sure patients who come to you, some elderly patients, also tell you that maybe this is something that you were told in your childhood and this is why you're feeling a certain way.
And I think as a parent, you still have to recognize and realize that you have certain responsibilities, okay? You will choose what time the food goes on the table. You will choose what goes on the table. But your child will choose how much they eat and what they eat, right? It is your responsibility to make sure that there are healthy options that are on the table. What I see commonly happening within the household is that everyone else is, eating whatever they want. It may be less nutritious foods. It may be options that are very limited on the table when it comes to healthy things, but it's nearly viewed as a punishment to eat those kind of foods, as opposed to creating a household and a culture that kind of just thrives within that kind of healthful eating as well, or at least to have that balance.
Right, right. And you rightly point out in terms of essentially the hormonal balances, and then the woman is sort of developing a lot of changes in the body, and hormones start developing, and then you start feeling a certain way. And especially for the topic that we're discussing today, which is wellness in 30s, uh, do you feel that because of hormonal changes, especially in 30s, the need for supplements also increase?
Yeah, so there are a lot of shifts that happen. Within your 30s, your gut microbiome also starts changing a little bit. So you may find that in order to deal with certain changes, you either have to change your food or you're using the help of certain supplements to kind of help optimize things. You may also find that certain nutrients, vitamins, minerals drop down a little bit because of change in quality of periods or because your demands are simply a little bit higher. So supplements do play a little bit of a more of a role when you're in your 30s compared to probably when you're in your 20s.
Got it. Got it. So let's create like a wellness starter kit for women in their 30s. If you were to sort of create a wellness kit for women in their 30s, like a non-negotiables, 3, 4 non-negotiables wellness starter kit for women in the 30s, what would that include?
Resistance training 3 times a week. Okay. Doesn't have to be in a gym. It can be in your home. It can be in a class, whatever you enjoy doing. But find out your movement and your exercise personality. Okay. Because consistency is key. The second is good quality sleep. Start tracking it if you're able to. So using a wearable is fantastic if you're able to. But for me, that's a non-negotiable. And the third is hitting fiber and protein goals. Those three, if you start adding those three in regularly every single day, you will start seeing a massive change in overall energy levels, health, and outcomes.
Awesome. What is that one myth that you'd like to bust about women's wellness in 30s especially?
It's too late to start. I think a lot of women think that because I've hit my 30s, I should have focused on all of this when I was in my teens or when I was 20 years old. We have women in their 60s who are building muscle, and it's fine. I think 30s is rather than this phase, and when I first came on here, I told you, right? Like at age 35 for me, this was a massive change in how I saw my body function and respond to outside environment. Rather than viewing it as a kind of death sentence or a sentence of doom, you view it as a golden opportunity. View it as your 30s as this time, as this window of opportunity where you can invest in your health to help improve outcomes in your 40s and your 50s.
Awesome. And if a woman feels overwhelmed with all the information that is out there, because I'm pretty sure there is so much information that's out there in terms of wellness, in terms of what nutrients to consume, what diet to follow. You
Yeah.
mentioned diet is you setting up to fail.
Yeah.
So and diets don't work, which clearly I am a true example of it. I know I follow a diet, but then I know that for a month or two it's great, it's fantastic,
Fantastic.
the
Yeah.
energy levels are here. But then on the 31st day, I'm like,
I'm
can we
done.
just skip to the good part?
Yeah.
So I'm pretty sure that there is a lot of information, and we get overwhelmed with the information that's out there, especially the advice that's given on the internet.
Yeah.
Do this, do that, the kind of nutrients to take, the kind of
Yeah.
supplements to take. Where should a woman start? Should it be her fitness? Should it be her mental health? Should it be the diet? Should it be a combination of all? What should it be?
So it's so nuanced. I would say the first is get professional help. The reason why people like us are around is we want to crowd out that noise. We want to be able to show you what is the easiest thing that you can do within your lifestyle right now that is going to give you quick results. And that could be different for one person compared to another person. So there's never one thing. But I would say the one thing that you find is the lowest hanging fruit. Choose that and work on that. Work on it for 2 months, work on it for 5 days, work on it for 7 days, work on it for 5 minutes a day, but start off and then
I
keep
think that
building from there.
becomes important.
Yeah.
Consistency is a problem. Dr. Aarti, that is something that I've seen essentially with diets.
Consistency is key in terms of finding what works well for you. So you don't need to be on a diet. I think you need to have balance, but consistency is key.
Awesome. Dr. Aarti, thank you so much for taking out time and doing this. This was very informative. as a man talking to you about women's wellness in 30s, I think I've learned a lot about how hormonal changes happen in a woman's body and how essentially what they can do to sort of work on it, whether it's getting the diet or getting the sleep right or getting supplements in place. I think it's been fantastic. Thank you so much for taking out time to do this. This was wonderful. Your information nuggets really helps our audience gauge better and take action better. So thank you so much for being on the show. What are your last thoughts of being on the show? How did you like the conversation?
Thank you so much for having me. And I think it's so important that we're having conversations like this. I want women, not only women, but also men to start becoming a little bit more, menstrual aware and women's health aware. I think that's what's needed for the future.
Thank you so much. This episode was brought to you by Swisse Wellness. They've been able to sort of facilitate the entire conversation. So huge shout out to Swisse Wellness for making this happen. To the audience watching, thank you so much for enjoying the conversation. This is one such conversation that I've been wanting to have with Dr. Aarti very specifically. And I think this is one such episode that will change the course of how women should be feeling and what changes that they need to be making in their course of lives. And I hope this episode helps you the way we enjoyed the conversation. I hope you also enjoy the conversation. Thank you so much for watching. I'll see you next Friday, same time with a fresh new episode. Till then, thank you so much for watching. Cheers.